Hi, I'm Dr. Michael Brode, Medical Director of the Post-COVID-19 program at UT Health Austin. Today, I want to address a common question. What should I do if I have long COVID and I get reinfected with COVID-19? In this video, I will cover COVID-19 treatments I recommend, when and how to test yourself, and the best practices about isolating or quarantining yourself to prevent the spread of the infection. So first and foremost, don't panic. Reinfections are unfortunately very common due to the evolving variants. Most patients with long COVID take a little longer to recover from reinfections, but due to their pre-existing immunity from prior infection or vaccination, and the generally weaker Omicron COVID-19 variants, they often experience a milder illness and return to their baseline health within 4 to 8 weeks. I fully acknowledge that for some people with long COVID, reinfections can worsen their long COVID symptoms or cause health setbacks, though this has been rare in my experience. To minimize this risk, it's crucial to prioritize self-care during recovery, get plenty of rest, and pace your activities and avoid overexertion, especially to prevent post-exertional malaise during the recovery period. Next, I recommend antiviral treatment. Antiviral medications like Paxlovid can shorten the duration and severity of COVID-19 symptoms and reduce the risk of long COVID. Although all the research has focused mainly on preventing long COVID, not in people who already have long COVID, using antivirals for those with existing long COVID is a reasonable approach to prevent long COVID from getting worse. Paxlovid is my top recommendation for antivirals. It's the most effective medication available. It requires a prescription and must be started within 5 days of symptom onset, ideally between 1 to 2 days after symptoms begin. Starting too early might increase the risk of viral rebound, so waiting a day or two is perfectly fine. The major thing to know is that Paxlovid can have significant interactions with other medications or supplements. Your healthcare provider or pharmacist will need to check for safety before you take it and may have to adjust your other medications. If Paxlovid isn't an option based on availability or interactions with your other medications, molnupiravir is my second choice for antiviral treatment, though it is less effective. Monoclonal antibodies are a distant third choice because it requires an IV infusion. Most of them are not effective against current variants, and they are no longer widely available. They're just not practical to get. Antivirals for COVID-19 are only FDA approved for individuals at high risk of severe illness, such as those over the age of 65 or with underlying conditions like heart disease or diabetes. While the FDA does not explicitly include individuals with long COVID, I strongly believe that long COVID itself puts people at high risk of complications from reinfection. If your healthcare provider is hesitant to prescribe Paxlovid or other antiviral treatments because you don't meet these strict criteria, I encourage you to have an open conversation about how long COVID may put you at a higher risk of having those complications. Many people also ask if they should take metformin for reinfections. Metformin is a common medication used for diabetes. Research from clinical trials has shown that individuals who took metformin during an active COVID-19 infection had a lower risk of developing long COVID, as metformin may have some antiviral properties. However, it's important to note that metformin has not been specifically studied in people who already have long COVID or as a direct treatment for the illness. In my opinion, metformin should only be used alongside an antiviral like Paxlovid, not as a substitute. For those seeking an intensive approach to minimizing infection risks, metformin can be started within 3 days of symptom onset and taken twice daily for 14 days. However, Paxlovid or another antiviral alone is sufficient for most people. Finally, there are certain treatments and supplements I recommend against taking if you test positive for COVID-19. First, I advise against using steroid medications like prednisone or dexamethasone early in the illness because they suppress the immune system and can prevent it from clearing the virus. Research shows these medications are only beneficial in hospitalized patients who need oxygen, not for managing early or moderate illness. Second, I recommend against ivermectin. It has been thoroughly studied in good faith, gold standard randomized controlled trials, and there is no credible evidence that it provides any benefit or antiviral effect against COVID-19. I hope this is not received as a controversial statement, but it simply doesn't work. The science is not controversial. Lastly, I do not recommend people take any particular vitamin or supplement. While common options like vitamin C or zinc are safe, there isn't sufficient research showing a significant impact on recovery. So while I won't say you absolutely shouldn't take them, they are no substitute for proven antiviral treatments. Next, let's talk about COVID-19 testing, whether people are concerned that their illness might be COVID-19 or they've been exposed to someone who tested positive. I recommend people test themselves with the home rapid antigen tests, which are available in most pharmacies. If you feel sick or have symptoms of COVID-19, you should test yourself immediately. If the first test is negative, but you are still continuing to experience symptoms, you should retest yourself after 48 hours because the research shows that the test is most likely to be positive when people are having fevers or 2 to 3 days from when the symptoms began. On the other hand, if you were exposed to someone with COVID-19 but don't feel sick or have symptoms, wait at least 24 hours before testing yourself if you're concerned about reinfection. If you remain symptom-free, after 3 days, retest yourself for reassurance. However, if at any point you develop symptoms, test yourself immediately, and then if it's negative initially, again at 48 hours. The last question I typically get is how long do people need to quarantine or isolate themselves if they are reinfected? Or how do I avoid reinfection from a close contact who has COVID? The CDC advises that most people can return to normal activities 24 hours after their fever has resolved without the use of a medication like Tylenol and their symptoms are improving. Additionally, they recommend taking extra precautions for 5 days from when the symptoms began, such as wearing a mask indoors, practicing good hand hygiene, and only being around others in well-ventilated spaces, since COVID-19 spreads easily in enclosed, poorly ventilated areas. This is good advice from the CDC for most people. On the other hand, the research suggests that with the Omicron variants, people can be contagious for an average of 5 days from when their symptoms began, but by day 10, almost all people are no longer contagious. Therefore, an extra cautious approach is reasonable for individuals with high-risk conditions, like long COVID or being immunocompromised, to minimize the risk of spreading COVID-19. If you prefer this more cautious approach, consider isolating for at least 5 days from when the symptoms began. On day 5, take a home rapid antigen test. If the test is negative, you are no longer contagious and can safely resume activities. If it's still positive though, you should continue to isolate and retest yourself until you test negative, or reach 10 days, whichever one comes first. It's important to use home rapid antigen tests you can buy in most pharmacies because they detect intact, contagious virus. This is different from PCR tests done at most hospitals or doctor's offices, which can detect non-contagious viral fragments and can stay positive for months even after people recover. Only the rapid antigen test can reliably confirm when you're no longer contagious. I hope this information has been helpful. If you're worried about reinfection, test yourself at the right time and reach out to your healthcare provider soon, because most treatments will need to be started within 3 to 5 days. Don't panic, get the treatment you need, and prioritize rest, hydration, and pacing yourself during recovery. Most patients with long COVID recover well from reinfections. However, it is crucial during the first 4 to 8 weeks to be kind to yourself, listen to your body, to give you the best chance for recovery and reduce the risk of reinfection worsening your long COVID symptoms. So please take care of yourself and be patient with yourself during the recovery.